When you're starting out to do things, the first thing people will always ask, they want to learn this flap and that flap and know all the complex things. And it's interesting because some of the flaps people want to learn about, I probably only use once a year, maybe once every 2 years. I know how to do them, but they're appropriate for specific situations. But it's funny that people want to learn, for example, the keystone flap. I might only do a keystone once a year. So it's not a common thing that I use a keystone for. But there are other things that you can do instead of the keystone, for example. It's better to be a master of a couple of flaps rather than knowing a little bit about all the flaps. You're better off learning and doing well a couple of basic flaps that will tide you over and that can be applied anywhere and everywhere. I always start with, what is your surgical technique like? What is your suturing like? That has to be perfect. And then once that's perfect, then you need to perfect doing ellipses. And the best place to start is on the trunk, on the body. The back is a common one. And in elderly patients, they've got lots of lax skin, so it's much easier to do surgery on elderly patients. And they don't care about their scars. It's not as if you're doing a 25-year-old woman's face. Make sure you perfect your surgical technique, your aseptic technique, your ellipses on especially your elderly patients, and they're the ones that have most of the skin cancers. Then once you have perfected that, then you can start learning a couple of little flaps that then you can start applying to sort of higher up on the body, like start around the neck and the lateral face. Once you've mastered those, you get to a point where you can just read about a flap in a journal and go, oh yeah, I can do that, and you apply it. And the reason you can do it, because your foundation of your surgical technique, your suturing, your basic ellipse excisions are perfect. And then you can really do any flap. You just get shown a flap, yeah, I can, I'll try that. So that's probably my biggest tip for people. And I've mentioned it before, as I'll say it again, if you are happy to do any of these procedures on your family members, you should be happy to do them on your patients.